Good morning, everyone.
Good morning, sir.
Good morning. Good morning. We have 35 strength here now. 32. Please put your attendance. So I'll be sharing my screen and coming to our discussion today. We'll be talking two things primarily. As first one is the different types of tablets. So we're focusing specifically on tablet manufacturing and granulation. I'll talk about that very soon. Now, anyway, this PPT is also there. I think you can see here. So when I'm talking about the advantage of oral dose and tablets, we know there are some specific advantages. I need not speak them. I think it is so easily understandable. I think first one is conveniently carried, right? Each tablet is normally made unit doses. Exception is there because depending on body weight and age, the dose may differ. So sometimes you may find that doctor may prescribe you half of a tablet, okay, or quarter of a tablet, but that is rarely done. Most of the time it is a full dosage form. You can really do. Readily identified, yes, we can distinguish them because of their shape, size, color, coating. Those things are mostly known. Easily taken. Prescribing flexibility is somehow there, not completely, I will not say like that. So for example, you can prescribe thrice daily, you can prescribe 4 times daily, or maybe sometime 50% of a tablet you can also prescribe. But even if that is not really done so effectively, efficiently and productively manufactured, that is true. So in a large scale industry, they can put some, maybe in a per day basis, they can produce some lakh of tablets, 3 to 5 lakhs of tablets production per day is not at all a big job for a big industries who are producing most of them in a coated or uncoated formulations. They can do it very easily. Package and shipping at lower cost with less breakage, like syrup, you need to have some container, right? Which is very difficult sometime to organize because recycling of those bottles, earlier it was glass bottles, now polyethylene, terephthalate, PET bottles are also being used, and they are definitely costly. So cost is already income with this included when we are going to have those things into market. In case of this, there is very nominal cost here for making this tablet stripping. Sometime it can be laminated one, or sometime you can have moisture resistance package is also there. Film coating, if it is there, we can have different packaging that we will discuss later on, but it is still more easy, more stable, and have a longer shelf life. Why? Because tablet do not contain much moisture, right? Moisture is not there. Of course, some residual moisture is there. So that means it will be more stable. So essentially, tablet is more stable in comparison to any other tablet or capsule, in comparison to any other liquid dosage form. Tablet is sometimes as source of a medicinal agent when it is not otherwise available. Yeah, sometimes we can also have this form of tablets formulation we use. These things we started in our last class: compressed tablet, multiple compressed tablet, sugar coated, film coated, gelatin coated. And gelatin coated tablets are very rare anyway. Enteric coated tablets, buccal and sublingual tablets, and chewable tablets. Of course, if I make a classification, there is some important things. The classification is basically made on what is the purpose, not only the shape or size or color, and how are they prepared, what is there. So this classification is basically based on the preparation and purpose. So for example, you are putting sugar coated tablet. You understand when you will put sugar coating. Sugar coating will be essentially required when it is not, the taste or odor is not really acceptable. We need to have film coated tablets. We can have a biopolymer film. We can coat it. Different kinds of biopolymeric material we can use, which is acceptable. And biopolymer coat can be different varieties. We can have dextrans, we can have cellulose. If I am using, for example, starch based tablet, and we can put cellulose coat, is fine. Dextran coat is fine. Alcoholic coat is fine. Of course, polymeric alcohol we can use. Gelatin coated tablets are used. The coating will be more stringent, and it can give more stronger durability of those formulations. We can have gelatin coated tablets also, like a capsule kind of things. But capsule is a cell. Okay, it is like a container, but coating is over the surface. So there is definitely a difference. Entry coated formulation can be a complex formulation, but the purpose is definitely known. Entry coated means it should not be allowed to break down in stomach. So that is definitely there. Buccal sublingual, we already talked. Type of tablets you see is still continuing. Molded, hypodermic tablets, very rarely used. Dispensing tablet, not so much widely used. Immediate release tablets are there, which will break down quickly. Extended release formulations are not so widely used for tablet formulations. Okay, it is not so widely used for tablet. It can give only you some moderately sustained release formulations. These are based on effervescence. What is the product outcome? Molded, I already told you, molded tablets are actually going to go for a small scale units. Okay, otherwise you will have compressed tablet machines are there. Hypodermic tablets are essentially they are going to be used for injectables. So through injections we can go and put this. They will no longer be tablet, because we have to dispense it and make a injectables. So this is actually raw material kind of things. Okay, dispensing tablets and hypodermic tablets are like that. So basically these classifications are not so widely adapted. Now compressed tablet, we can have, what is the composition? If I say medical ingredients or active ingredients, we will have diluents, adjuvants. Essentially the anything except these things is, except the medicinal compound, is called excipients, right? It can have diluents or filler, and you know what is the best widely used diluent is starch. Binder and adhesive. Starch can also act as a binder or adhesive. Wetting agent is compound which can absorb more water. One example can be glycerol or glycol we can use. Disintegrating agents can be some carbonate salt, bicarbonate, or all those things. Free flowing agents also be using, like these are called gliadants, lubricants, lubricating agents. Okay, anti-adherent for the tablets to adhere each other. Basically this depends on how we are going to talk. Gliadants is for mostly we'll be speaking on powder form when we are using. Lubricating use for the completely solid dosage form. Two tablets should not bind to each other. Then we'll put lubricants. So enhance the flow of the tableting material, or even tablets, prevent the sticking of the filled material to the punch, and produce tablet having, say, maybe for example, reduce the friction between the tablets. You understand the wordings. So first one when I'm talking is about the powder form, right? There should not be much difficulty when you're talking about the powder. They should not stick with each other. So we are putting gliadants so that the powder come through the holder in efficient manner. There will be no clogging, right? Just to avoid that. And when it is going to punch is a pressurizing unit, right? So when you are pressurizing this tablet, so it is very likely that they will stick on the punch surface. Okay, we should have anti-adherent compounds, and the tablet is ready, and now one tablet is going and another tablet is going to be filled, right? So if they stick together, then also a problem, right? Because each tablet will be coating, I mean to say stripping machine will have individual tablets separating out, right? So they should not mix. So that one we need to have some lubricating agents also. So basically they are not much different, but the thing is that what purpose we are going to have, that is very important. Now you can see here different types of structurally different types. We can have double layered tablets, we can have tablet inside tablet. This is the diagram only. Double layered maybe, for example, this component and this component, they are not really compatible. If we mix it together, for example, this ingredient and this both ingredients will react somehow. So better way is that, okay, you make a tablet, above that you put the powder again and again press it. So you'll have double layered tablets is possible. And similarly, we can have a tablet inside tablet is also prescribed when we are going to have a complete coating, I mean to say coverage of the inner material. So maybe this is not this compound may be unstable, so it does not stay for a long time, and we are going to give a tablet out around it. Of course, this portion also has some drug, so more than one drug, which are, so if you ask you multiple compress tablet or MCT, the main purpose is that we can have more than one compound and we do not want them to react, right? So we can have multiple layered formulation. Why? We can some reason is that we can go them separately, and tablet within a tablet is, of course, we need a special machine for that, because it should not be feel like a powder. Purpose is protecting and enclosing the drug from environment, that is one part. Providing a barrier of the objectionable testing, like a coating part, and permit impregnating or identifying marks. So these are all easy things. Most importantly, which is not mentioned, is that you may have two active ingredients, two components together. Okay, so for example, you are going to take some analgesic and antipyretic, same drug, right? You will have pain relief, also you will have relieving the fever. Now if the two compounds, if I am mixing, for example, actually there is no problem in this case particularly, they are completely mixed, there is no reaction. But if we feel that there will be some reactive agents, we can put in a layered, so one layer and another layer, so there will be no reaction when we are keeping them in tablets. Of course, when you are taking it, then everything will be broken down in your stomach, so that is not the problem is for storage, long time storage. A tablet is prepared today, and maybe after 1 year or 2 years somebody will take this tablet, right? So 1 year storage time period is there, and that time tablet activity should be there. We'll talk about that also, how much active ingredients, that is the quality control of tablets will be doing. What is the disadvantage here? We need to have a little bit more costly here, we need more time, and of course the other additive cost will actually increase when I am going to have MCT or SCT formulation. Film coated is compressed tablet coated with a thick layer of polymer, as I was telling, forming a skin like film over the tablet. Okay, so that is actually going to protect it if it is going to be degraded or unstable in the natural environment. We can actually have a protection, so we can do that in later on phases, right? Now when we are talking about gelatin coated tablets, gelatin coat, you know, right? Gelatin, okay, gelatin is a protein, much more flexible in structure, and we can use it in coating of these things. Capsule shaped gelatin coated compressed tablets are also there, which looks like a capsule but definitely not, because there is no really two, it is like a two. When I'm talking about capsules, capsule means hard capsule, right? So it is already a container is there, and we will have two, one is inner cover, another is outer cover, right? So mostly capsule will have two covers, so an ingredient is filled. But when I'm making a coat, it is a single coat. I'm having a tablet, and coating layer is deposited, rather is not a packet kind of things, it is deposited on the surface. So this kinds of coating is also there, but not very frequently we observe. So what is happening here? 1/3 smaller than capsule, okay, because it will be smaller than capsule with an equivalent amount of powder. So less bulky, right? In capsule, what happens? Capsule, it is powders are there, right? Powders means it is more bulky. It will take more volume. But if I'm compressing into tablet, volume is small. So we can have equivalent amount of drug delivery in comparison to capsule. Tablet is smaller, right? Because it is all pressurized. So we can have this facilitated swallowing and more temper evident. Temper evident means it is not going to break off. It is not going to, because many times the capsule can actually, cells can be separated. If I'm keeping a capsules not in a proper conditions, the two cells may come out one another, and that formulation you cannot use it. So that is the problem in case of capsules, which you can improve when I'm going to use in a tablet form. Of course, when we are having a appropriate coating material is there. Entry coated, what is the meaning of the entry coated? It should not be broken down when you are going to release it in stomach. So it should be long time, at least it will give some few hours of stability when I'm going to use an entry coated formulation. You see, ECT are designed to pass unchanged through the stomach. That is the only definition you should keep in mind. So we should have some coating which will not dissolve. So what kind of coating we can have? Which is acid resistant, right? We should have a coating which is not going to dissolve in acid. So that coating essentially requires some form of polymer, and we must use them. So it can be, what is the purpose? Drug substance. If your drug is actually degraded in gastric acid, then only you will do, right? Otherwise you should not do. Unnecessarily you should not increase any cost. So if your drug is hydrolyzed, broken down in stomach, we should look for entry coating. Or drug substance is irritating to the gastric mucosa. Yeah, if it is not even degraded, if the drug is making a problem, then you can also make a coating for this. Okay, it is also improving the absorption process. So lower dose can be included because there is no loss in stomach. So they are directly going into intestine here without breakage. So most of the drug is actually absorbed in intestine, right? Stomach, nothing is absorbed really, except some amount of water, small amount. So most of the compounds in your formulation will be absorbed in your intestine. So most drug coming into intestine, so absorption can be always better in comparison to earlier one. Buccal sublingual, I'll skip it because we have already told you. Buccal is in your total oral cavity. Sublingual is below your tongue, so you can really have more efficient delivery. Okay, so you see, drug intended for local effect in the buccal cavity, buccal tablets, or we can have those things which can be used in sublingual form. Effective delivery, drug is, if the drug is destroyed, we can avoid taking it GI tract. You can put sublingual tablets for some of them, which require early onset of actions, right? We want to have it more quick. You see, now what is the, okay, these things already we discussed, lozenges and troches in our earlier class. They're actually basically made up of sugary material will be mostly filled over there. These are only just a variant of buccal tablets we can use. Their purpose is designed to dissolve and promptly provide rapid drug effect. That is their purpose. What they contain? They contain sugar-based material in lozenges. Torches are also similar, but maybe we can have some liquid sugar can be also included in these formulations. Being slowly dissolved, usually localized effects can be seen. Chewable tablets, we need to break it down, so they are not really easy. That means we need to give more time, right? We should keep it more time in our buccal cavity. So that is the purpose we are going to chew to dissolve in this mount. So this is not disintegrating itself. Rather, you are advised to chew it up. So basically, it will give you more administration in a larger size when you are going to have it. Otherwise, you cannot really swallow it. Maybe difficulties there. Mostly, yeah, that you already know. Mostly, we are going to give these kind of things. Particularly, people might have used calcium vitamin C, those things are often used in a chewable formulations. Effervescence we have discussed. Molded tablets, as I told you, is a tablet tracheuts may be prepared by molding rather than compression. Okay, so we are forcing the dampened powder under low pressure in a dye cavities, not like a compressed one. So it is more easily friable. It will be more comparatively soft and easily broken down. So it will be having rapid dissolution. But most of these large industry do not follow those procedures. So maybe they can go for larger tablets. Tablet tracheuts are actually components essentially we are going to have in small, usually cylindrical molded compressed tablet containing small amount of usually potent drug. But that formulation is not really widely available in nowadays. They do not have it, but still can be only few tracheuts are available today. Most of them TT produced by tablet compression. So you please keep in mind sublingually as nitroglycerin tablets are used. So these are not really widely used. So I'll just skip them. I'll not have in my discussion. Hypodermic is, you see, it is really not so much useful. HT1 type of dispensing tablet, molded tablets are originally used for physician in extrapurinous preparation of parenteral solutions. That means they're getting the tablet and they are going to dissolve it. So there is some problem also, because now when you are going for injectables, you will have powder, right? And you will also get sterile water. Both the things are coming together. What the physician has to do, take the water, dissolve and inject. So possibility of infection is very low. But when I had a tablet and you need to dissolve it separately, so possibility of poor dissolution, possibility of dose variance, all those things was there. So that's why actually it is very difficult to achieve the sterility, and those formulations are now really abundant. These things are not really used. So I'll skip those things. Okay, this thing is very important here. That is immediate release tablets. Immediate release tablets are intended for quicker action or delivery. So it is rate controlling feature, a special coating, another technique we can have in immediate formulations. Now, okay, type of tablets: instant disintegrating and dissolving one. Instant release tablets, you see, disintegrating and dissolving in mouth within 1 minute, in some cases of 10 seconds. This can be one of the product which is more effective when we are going to have early response is required. You see, after placing them on the tongue, they will liquefy and patient is going to swallow the liquid. So very easy to handle, because if it is going to be solution, if it is going to melt down, then these formulations can be easily managed using this kind of disintegrating and dissolving tablets. They dissolve by absorbing the moisture in atmosphere and moisture in your buccal cavity. So we are having some saliva, right? So saliva will actually do the job for dissolution more easily. Of course, this is designed for patients, pediatric and geriatric patients. So child and old age people will likely to have some formulation is there. Soft compression is used inside as water soluble excipients can be used. Extended release is for extended means we are going to use the formulation for very long time, but doesn't mean that in terms of couple of days it is not going to work in your stomach. So if I'm going to have few hours more extension, then you will go for extended release. So extended release tablet, control release tablets are designed to release their medicine in predetermined manner over an extended period of time. But extended period does not mean that it is going to be some 3 days, 4 days. It's within an hour, few hours. So that is only achievable because we can only protect it. We can until or unless, but there are some formulations are there, of course, which is formulating as a patch. That kind of dosage forms are also there. But apart from that, if I'm going to take it in oral route, then they will only give you a few hours of extension time. And this is for pharmacopoeial purpose also they can use. Prolonged action, sustained release. Prolonged action means it will be increasing the blood drug concentration over long period of time. Sustained release means drug is absorbed for a longer period of time. So there is a difference. This terminology are not really similar. Prolonged action means in blood, you will find the drug concentration is extended. And when I'm telling prolonged or sustained release, so this is prolonged action. Sustained release means dissolution of the drug or solubility of the drug is going to fall very slow. I mean to say the drug concentration is going to fall very slowly. In what is that? That is in your gastric fluid or in your intestine. So drug is going to be absorbed very slowly. How can you reduce the absorption? There are many methods. We can use, for example, we want to reduce the absorption, we can use some composition or some hydrophobic compound along with this formulation. So they will put a oily coat, and through that the hydrophilic drug really cannot cross. So we can actually add some additives, excipient, to increase or prolong the release or absorption of the drug if it is required. Some tablets can be of vaginal tablets also, which can be uncoated or even coated one, which can be inserted, and it can have a localized, not only localized, but it can have also some systematic applications also there. Antibacterial, antifungal properties can be also there in these kind of formulations. Just a second, please. Hello. I'm having a class now. Tell me. For what? Leave. You can apply. And okay. Fine. Okay, now when I'm going to talk about the city, we need to have some quality and competitive standard. That means what should be the control there. So there is always something on the shape, apparent physical feature of the compressed tablet, and the thickness of the film is also important. Diameter can also vary. Shape is also going to change. Okay, you can have some unscored or scored in halves, third or quadrant. What is scored? Scored means sometimes you have seen one tablet is there, in between one central line is there. You may observe in many tablets. Okay, this purpose is just you can break it, right? So if you want to have many times, if the dosage is also going to be given in half form, then they will have a scoring line. In some cases, you can have more than one scoring line also over the tablet. So depending on, this is for dosing, the score is for dosing purpose. So we can also have these requirements depending on what we are going to have. Engrave and imprinted identifying symbol. Many tablets you will see at the back of the tablets either the company logo or company name or their what is the active ingredients. They will not put active ingredients, but the formulation name by this company, trade name, can be also be engraved when it is required. It can have coated, uncoated, colored, uncolored, number of layers. These things may be there. Dye punch determine the physical feature of the compressed tablet. What kind of dye and punch you are going to take, that will also determine the shape and size and all other property, physical appearance of those things. More controlled manner. You can have really need to go through, or someone has to go through those requirements when they are going to choose for city. Other physical specification and quality standard may also be incorporated, and they should know what about the tablet weight and weight variation. These are actually, when I'm talking about standard, we are actually talking about how they vary. Because you see, a company is producing some, maybe some time of nearly some few lakhs of tablets per day they can produce in larger industries. But point is that if you are having so many tablets, is the drug going correctly? This is the questions of quality control. So for example, I'm having some 10 tablets. Do they contain the amount of drug they should contain? These questions will come definitely. And these are in-house in the industry itself. They want to validate. They will go for tablet weight. They'll go for weight variation test. So of course, You cannot do for each and every tablets you will go and measure, not like that. In a batch, we normally go for 20 for example, I'm going to take in a batch some 20 tablets randomly, and we are going to measure how much weight variation is happening. Content uniformity, is the drug content, how much is there in these tablets, we have to validate. Tablet thickness, we need to validate. So these things should be always there in a compendium range. Whatever you have specified, the company has specified, they have some quality standard. So how they are going to validate? They want to tablet hardness, tablet disintegration. These properties need to be assessed in each and every batch. Some set of samples are going to be taken, and they are going to make it pass. The whole batch will pass or whole batch will fail, depending on how much variations they do allow for those things. You got my point? So for example, you are asking for 500 milligram of paracetamol, and we are measuring 20 tablets. Somewhere I'm getting 520, somewhere getting 490, somewhere getting 500. It will definitely vary. You cannot say that all in all tablet it will be exactly 500 milligram. Not possible. So, but question is that how much variation the company will allow or permit according to their pharmacopoeia standard is going to be known, and they should understand those properties. For tablet, these all properties are important, right? How much hard is that? Hardness is required. Why? If tablet is not hard enough, they will break down. When you will open the tablet strip, you will find that you are having a powder because they have already broken. Hardness is not there. Drug dissolutions. So because if when I'm going to take the tablet, it should also dissolve and drug should come into your aqueous phase. Is it coming into dissolution process very effectively? If not, you need to have these standards and you need to control. So these are all going to come about in process other controls parameters. Verification after the production they will do in the same industry itself. Now, for example, here they are going to take you some tablet weight, and for example, we are going to have chip weights also. So when I'm going to have some the quantity of the pill placed in a dye cavity of the tablet press determines the weight of the resulting tablet. It is very true, because your punch is actually volumetric punch, right? We have know that okay, this is the lower punch and upper punch will come up to this point, right? This is fixed. It is your machinery is fixed. That means this much will be the total amount it is going to be compressed finally. So if I am having very fine powder, finely powder, so and you understand if it is fine powder means compressions will be more here, will be more compact, and for the same volume I can have large weight, the mass can be high. But if you are having granules, that means the amount of material or weight of the tablets can be here low, because actually the punch is making only volume part. It will only compress up to this volume. So now the same volume, you always understand, if I'm having same volume, if I put powder, there is no space between them, right? It will be more heavier. And if I'm having a granule of the same volume, I will have little bit lighter weight. So how much drag will go? Of course, not that much space is not there, but anyway, I'm just trying to show you. So it always depends on how much weight is there in the punch volume. How they're going to check these variations here? Sample amount, as I told you, some 20 sample they're going to take, and they'll go to find out what is the mean values of them and standard deviation. So for example, let me talk about few tablets. 20 tablets I'm taking the weight. I'm going to take their mean, right? And I'm also going to find out their standard deviation, right? Or standard deviation. So for example, in most of the pharmacological regulations, they will use, okay, plus or minus 1.9 sigma. That means, for example, I need some 100 milligram of dose, 500 milligram of dose, and we are allowing only 1.9 into standard deviation. So for example, this is becoming some 15 milligram, for example. So that means the drug can be permitted, the batch will pass if every one of these is coming within 485 and 515. Just for example, this is not correct one. So you can decide, or the regulatory can decide whether the whole batch, if they are failing, then whole batch will fail. So this stringency is always there when we are going to look for the tablet. So you see, they are going for weight variation. They're talking into percentage basis, but essentially they will be going for batch in a normal distribution assumption. So when I'm having a tablet less than 0.3 or more than 0.3, we can have variations within plus minus 7%, 7.5% or 5%, depending on how much dose we are going to have. This process is already given here. This is not really required for pharmaceutics people. It is really required. So they are going to accurately take 20 tablets, calculate their average weight, as I am going to tell. Then individual each of the 20 tablets, compare the weight of each tablet with the labeled tablet. So for example, a labeled is 500, and how much is there? They are telling no more than 2 of the individual weights exceed the weight variation limit. Okay, so if out of the 20, if the 2 is only maximum, for example, we are going to have, then we will go about whether this batch pass or batch test, this variation limit will be approved or rejected. Here, okay, I think until this point it was fine. This was what was the intention of this half an hour discussion was very simple to tell you what are the different form of tablets. Simply summary, what are the things you need to look for when you are going to validate the tablet formulation? We will validate all those physical property, right? Apart from that, also many other tests are there. Dissolution tests are there. In pharmaceutics, you will learn if you study someone how they measure how much time the tablet is taking to dissolve complete amount in a gastric fluid. Normally in a lab, the dissolution apparatus is there. So they will put the tablets and they will like in our stomach, there is also a motion is there. Similarly, to simulate the same behavior, this one dissolution apparatus have a blending devices which will rotate clock and counterclockwise. After some time, for example, you know that half an hour time is the period. After half an hour, how much tablet is dissolved? First of all, how much is the drug concentration in the aqueous layer fluid? So we can have a mimicking experiments in lab to study the dissolution. Similarly, disintegration and friability test that is not mentioned here. A friability test is like a horizontal kind of disc is there. Central rod is there, right? Okay, so disc is rotated. Actually, if I show the disc in a vertical shape, it is like this. Some small shape of okay, like a pan kind of things, right? So this pan, we are putting those tablets, and pan is made it vertical. So this pan is no longer like this. This pan is like this, and inside the pan there is a serpentile spacing is given S normally. Now tablets are here also, and we will rotate it. So what will happen? Tablet will go up and fall, go up and fall. So what will happen? Some of the tablets will break down. Of course, for example, after 100 rotation, out of the tablets, how many are broken down? That is called friability. Friability test is very important test when we are going to quality check for solid dosage form, particularly for tablets. So there are many other tests we will be discussing later on, not today. Now, from now onward, we will be talking about how the tablet is being prepared. This is very, very important aspects. And before I speak about the granulation, this is actually, there are two methods. One is granulation part, and another is the compression part. There is two variation. One is wet granulation and dry granulation. I will speak on them, but not here. I will speak for some time, maybe using my PPT itself for 5 more minutes. So you have decided, or maybe the pharmaceutical industry who is making this formulation has decided what kind of material to be included, right? But how to do that? And what is granulation? So few slides I'll discuss. That is about formulation, right? Preparation of tablet kind of things, you can assume. So essentially, when I'm going to say tablet preparation, the first step will always come as granulation. What is that? Very important. Now, most of you know that whenever we are making some tablets, we are dealing with some powder. Now, when I am talking about powder, you understand the particle size can be some 10 micrometer size or 100 micrometer size powder, right? Powder, what is powder? Powder is also some granules, very small granule, which can be different shape. Some can be spherical, some can have oblong shape. Okay, so the shape and size can always vary. A small particle, but this is very small. Of course, I'm talking about the mean diameter. So these are all powder form. Now, what is the problem with this powder? Because the powder is the small particle size are there, and you already know that when we are preparing tablet, it is not only one powder, right? There are many. For example, your drug, I'm making some paracetamol tablets, so I'm having paracetamol powder, I'm having a can of paracetamol powder, dust kind of things. Particle size, for example, 100 micrometer normally. Now I'm having starch, because starch you will also put, right? Starch is even fine powders, maybe even some 10 to 50 micrometer particle size. Of course, the size is different. Maybe starch may be more irregular shape. And we are also having, for example, magnesium sulfate, lubricating agent. Also, this is a powder initially. Now, question comes, do you think the density of all the powders are same? No. Their particle shape and size are same? No. Someone will be very spherical, someone will be irregular shape and size. Now, you have to mix them together, right? Like when you are preparing a dough kind of things, but solid. So when I'm mixing this powder, this powder, this powder in the same holler, and of course, you are mixing together, even if you try to mix, because their shape and size and particle size are all different, there will be always a tendency that small particle will try to be at the bottom, smaller size particle will try to settle in the bottom. It will never be homogeneous. Are you getting my point? I'm going to mix two different powder, it is really impossible. If their shape and size are different, they will not mix effectively. But then how can we deal that? So if I directly make this powder and it is going through, for example, a tableting machine, right? So on a platform, this powder is going, and of course some vibration is there. So what will happen? The small particle is there and larger particle is there. Larger particle will move easily. Small particle will settle down at the below surface. And when we are punching, what we will see? Will feel that okay, powder is, the small particle is not coming, rather the big particle is more coming. Maybe starch is more coming, magnesium sulfate is more coming, your paracetamol did not come, and you're punching. So problem will be that in each of the tablets your drug concentration will vary, maybe very low in your active ingredients. Why? Their physical property are different. Now, okay, what can be done in a better way? And that process is known as granulation. So rather than using powder for tablets, because there will be flow, will be some differences will be there, preferably we prepare granules. Granules can also be done in the same manner, but what will happening here, rather than making the whole blend, they will put them together, whole mixture, they will try to mix, not uniformly definitely, and they will pass it through two roller. For example, this is one roller, that is for dry granulation. For example, the whole mixture we are passing through the roller. So what will come? It will come as a dry seeds or flake. Okay, thin flake or seeds will come, and then we will crush it, we will break it down. So what will happen? We will have bigger entity of the mixture. Each of these granule contain everything. It will not that only it will have starch, your paracetamol, and for example magnesium sulfate, everything is there. Of course, every granules are not even, but somehow everything will be distributed. So granules will contain more homogeneity. But now if it is a granule, now you may say, what is the granule size? Of course, granule size can be in terms of 1000 micrometer, bigger size. and 1000 micrometer means some few millimeter, right? So granules can be millimeter to few more millimeters, so 4 millimeter, 6 millimeter granule, which you can actually pick up, right, using your fingers also. This size will be there possibly. So granules is of definitely irregular shape. They are not smooth, larger size, but all of them are irregular. So what is the advantage? On a flat platform, if all the granules are moving, they will move very easily without much glitches, right? They can flow easily. So granulation is done for primarily one reason. The first reason is that particle size and shape can vary, but if we make a granule, we can ensure that each granule will contain all the drug and the granules will flow very smoothly. Compaction of the granule will give me always the same composition every time. Nothing will settle down because each granules are of similar kind. They will go, they will be compressed, and tablet will have always good characteristics. So granulation is making from powder to bigger particle. Why? Because powder has a tendency to settle down, granule is more easy to handle and go for preparation. So that is the introduction for the granule, and there are two methods are there: dry granulation without adding any water, we'll do the granulation, and wet granulation when we can put some solvents, not necessarily water, we can put some solvents. So that aspects we will be discussing in our next class, because it is already 9:48. I will stop myself here. If you have any questions or queries, you may ask. If there is nothing there, then you can leave.